All right, we're in here. Welcome back, everybody. Once again, up to Dr. Bob Lee. Thank you for tuning in. Thank you for checking it all out. Our next guest is the Acting Assistant Commissioner with the Harlem Bureau of Neighborhood Health. He joins us today to speak about the Crush COVID initiative and how they are pushing for health equity in at-risk communities. So please welcome to the show, Padmore John. Welcome, welcome, welcome.
Thank you very much, Bob. We greatly appreciate it. Thank you so much for having me on today.
Yeah, you had the big Zoom the other day. Tell us about it and how can we continue to help?
Yeah, absolutely. Thank you so much for that. Yeah, we did have a big Zoom. It was basically speaking about the variety of organizations and individuals that are providing information around the vaccine. As we all know, we've been under the troubling challenge of dealing with COVID over the past year, a little bit more than that, and it has been a serious challenge. And one of the ways that we see the biggest tool that we have right now to help us get out of that is the vaccination. We have 3 vaccines, 2 of them are currently being utilized right now, Moderna and Pfizer. We know the Johnson & Johnson has been paused. We hopefully that will come back online soon. But we want to make sure everyone knows all the facts, all the benefits, what role these vaccines play in getting us out of this current situation with COVID-19.
And all of that was presented on a Zoom, and I'm sure you spoke about the health equity for at-risk communities, right?
Yes, as you are seeing all the time in the television, all over the place, there are 2 different ways that health equities have been impacted and exacerbated by COVID-19. First, in those who have been most impacted, who have gotten the most cases, been in the hospitals the most, and have died the most. And these are predominantly individuals in communities of color. These were communities that were initially least invested by our city, by our state, by our country, right? Yeah. So they were the most at risk. And then in terms of the vaccination process, making sure that everyone is getting access, it has been very challenging. We know that one of the biggest ways for you to gain access to the vaccine is through the internet, just being online and being able to get an appointment. And that has been challenging for many individuals in our communities. So we want to make sure that there are other ways of doing that, working with community-based organizations in certain places where the Department of Health has allowed those who are 50 and older to just walk in, and even come into various neighborhoods, NYCHA developments to bring the vaccine to people so that it's a little bit easier to access. And that's what this whole process was all about. The whole webinar was about the different ways that that we are all working together to be able to crush COVID-19 by bringing the vaccination information and the vaccination itself to people.
Yeah, and you're working with the Greater Harlem Chamber of Commerce, Patricia Ricketts, and of course, Lloyd Williams and the whole crew up there. That team is tremendous. They do great work in the community. They've been doing it for many, many years.
Many years.
Yeah, talk about that interaction with these organizations.
Yeah, I think it's crucial. It first began in just having conversations amongst a group of organizations, and I think this is really important. Is the different organizations that have come together. It has been community-based organizations. It has been health department, hospital, universities, Columbia and City College, as well as other medical practices, right? So this is really on the ground, up and down in terms of various spaces within governmental agencies on the ground with community-based organizations working together under the leadership of the Greater Harlem Chamber of Commerce, which we know has been doing so much good work in our community way before COVID-19 happened, but specifically in reference to COVID-19, helping in donations of food, helping in coordination of activities, strategically being able to activate resources for our communities, and that's really important. And when these organizations come together, it just shows the strength of our community, the resilience of the community, and that's really what we were trying to demonstrate.
Yeah, and what are you telling our communities in order to, what can our community do? What part can we play to help eliminate COVID-19?
Right, so I think it's really important that everyone first and foremost become educated about the facts around the vaccine, the facts around COVID-19, how much it has been impacting our communities, our families, our friends, the toll it is taking on our community, right? So I think it's very important that we are very clear about that. And then being able to know exactly what role the vaccination is going to be playing in bringing us towards a sense of normalcy. And then the oppressive reign right now of COVID-19. So it's important for everyone to be able, if you're on the fence about why it's beneficial, reach out to one of these organizations I mentioned before, the Department of Health, the Greater Harlem Chamber of Commerce, some of the churches. I think one of the key components was the faith-based organizations represented by Reverend DeGraff yesterday from the Kingdom Baptist Church, and many other churches that has formed and been part of this coalition of getting information out. So to go to some of these spaces to ask these type of questions so that you're able to educate yourself and then find ways of getting access to the vaccine.
Including the Visiting Nurse Service of New York.
Including the Visiting Nurse Service, which is playing a very, very important role. These are one of the especially for individuals who are unable to come to the sites where vaccination is being provided, that the Visiting Nurse Service, as well as Department of Health and the federal the fire department, is going to those homebound individuals who cannot leave their home. So they're playing a very vital service.
What do you tell people about wearing their mask and watching their distance and washing their hands?
Yes.
I call it the 3 W's. www. Wear that mask, watch your distance, stay out of the crowds, and wash your hands.
Very important. And I think that's really, really key point, Bob, in terms of stressing that even after we have been vaccinated, we should still continue to do those 3 W's, as you call them, that we should continue to protect ourselves, because even though we are vaccinated and we are not going to get as sick or more likely die from the illness, we can still transmit it, right? So we definitely want to make sure that we are not giving it to anyone else who has not yet been vaccinated. That's very key. We want to make sure that we're still providing the social distance and that we're being aware of how we are feeling, realizing that it's important that we take care of ourselves. And Bob, just wanted to point on that as well. We know that there's a lot of stress that is happening. Everyone is under stress, they're getting this COVID fatigue. But it's really important that individuals, families, friends, community also take care of their mental health as well during this time. It's important that we are addressing our physical health, but in terms of being able to have someone you can speak to, whether it's a professional, a therapist, a counselor, a psychoanalyst, whatever it may be, or even just a friend that you're able to get some things off your mind, that's helpful.
So we go to the Greater Harlem Chamber of Commerce website to learn everything that that took place yesterday.
That's correct. We will have a link on the website where individuals can go and just be able to put that on there, and you'll be able to take you to the event that happened. As part of the event, there was a lot of resources that are given in terms of being able to increase access to the vaccine, access to information, access to even supporting mental health. We want to make sure that it's available to as many people as possible. We had a great turnout last night, but we know everyone was not able to come out there for whatever reason, and we want to make sure that it's still available to the public.
Excellent. Give my love to everybody there, right? You want to give them a quick shout out because they're going to wrap us up real quick.
Yes, definitely to the Greater Harlem Chamber of Commerce. The Greater Harlem Chamber of Commerce and all the partners that are part of the health committee, as well as the larger chamber. We continue to appreciate all that you do. We continue to be supportive and looking forward to being able to be part going forward in helping us crush COVID together.
Thank you so much. Padmore John, thank you so much. We appreciate you. He's the Acting Assistant Commissioner, Center for Health Equity and Community Wellness. That's Department of Health and Mutual Mental Hygiene. Thank you, thank you, thank you. We appreciate you, man. All right. Unfortunately, that's all the time we have for today's show. Oh no, we gotta go, but we'll be back. Thank you for letting us share in this space and time with you. And always remember this: what you are is God's gift to you, and what you make of yourself is your gift to God. So choose your choice. Let your choice control the chooser of the Dr. Bob Lee. For all of us here at BronxNet, have a great and enjoyable day. And I'll see you over 107.5 WPLS. Catch you another day, another way. Love you all. Peace.